Imagine a world where a simple cut on your finger could be deadly, a world where the smallest injury could spiral out of control, leading to severe infections that no medicine can cure. This might sound like a dystopian nightmare, but it's a looming threat we face today. Imagine common infections becoming untreatable. Everyday illnesses that we once considered minor could become life-threatening. The bacteria that cause these infections are evolving, becoming stronger and more resistant to the antibiotics we rely on. This isn't science fiction. It's the terrifying reality we face with the rise of antibiotic resistance. Antibiotics, once hailed as miracle drugs, are losing their effectiveness. The overuse and misuse of these drugs have accelerated this process, creating superbugs that defy our best medical efforts. By the year 2050, superbugs could claim 39 million lives annually. That's more than currently die from cancer. The impact on global health would be catastrophic, overwhelming healthcare systems and causing untold suffering. We need to act now before this silent killer becomes an unstoppable pandemic. Investing in research, developing new antibiotics, and promoting responsible use of existing ones are crucial steps. Public awareness and global cooperation are essential to combat this threat. The future of medicine, and indeed humanity, depends on our actions today. Superbugs are not some monstrous new life form. They are bacteria that have evolved to survive the very drugs designed to kill them. Antibiotics. Just like we can build up resistance to certain foods or medications, bacteria can become resistant to antibiotics over time. This makes it incredibly difficult and sometimes impossible to treat infections. Antibiotic resistance is a natural process, but our actions have accelerated it at an alarming rate. Every time we use antibiotics, we expose bacteria to them. Some bacteria survive and pass on their resistance genes to their offspring. This creates new generations of bacteria that are even harder to kill. The numbers paint a grim picture. According to a landmark 2016 report, antibiotic resistance is a global crisis. Without immediate action, we could see 10 million deaths annually from drug-resistant infections by 2050. This would have a devastating impact on healthcare systems and economies worldwide, costing trillions of dollars. One of the biggest drivers of antibiotic resistance is the overuse and misuse of these vital drugs. Antibiotics, which were once hailed as miracle cures, are now facing a crisis due to their excessive and inappropriate use. In medicine, antibiotics are often prescribed unnecessarily for viral infections, against which they are ineffective. This not only fails to treat the illness, but also contributes to the growing problem of antibiotic resistance. Patients sometimes demand antibiotics for conditions like the common cold or flu, not realizing that these are caused by viruses and not bacteria. In agriculture, they are routinely used in livestock feed to promote growth and prevent disease in crowded conditions. This practice is particularly prevalent in large-scale farming operations, where animals are kept in close quarters, making them more susceptible to infections. The antibiotics help keep the animals healthy, but at a significant cost to public health. This widespread use creates the perfect breeding ground for resistant bacteria. When bacteria are exposed to antibiotics repeatedly, they can evolve and develop resistance, rendering the drugs ineffective. This means that infections that were once easily treatable with antibiotics are becoming harder to cure, posing a serious threat to global health. Scientists are now racing against time to find new solutions and alternatives to combat this growing menace. The consequences of inaction are dire. We face a future where routine surgeries and treatments, like chemotherapy, become incredibly risky due to the threat of untreatable infections. The widespread use of antibiotics has been a cornerstone of modern medicine, and losing this tool would be catastrophic. The good news is that we can still turn the tide. Scientists are working tirelessly to develop new antibiotics and alternative therapies to combat resistant bacteria. However, this alone is not enough. We all have a role to play in combating antibiotic resistance. Individuals can take steps like only taking antibiotics when prescribed by a doctor, ensuring that they follow the exact dosage and schedule recommended. Misuse or overuse of antibiotics can lead to resistance, making it harder to treat infections in the future. Completing the full course of antibiotics, even if you feel better, is crucial. Stopping early can allow some bacteria to survive, potentially leading to a resurgence of the infection and contributing to resistance. It's important to understand that antibiotics are not a cure-all and should not be used for viral infections like the common cold or flu. Practicing good hygiene to prevent the spread of infection is another key action. Simple measures like washing hands thoroughly, using hand sanitizers, and maintaining cleanliness at home can significantly reduce the need for antibiotics. Educating family members about these practices can create a healthier environment and reduce the spread of infections. Governments can implement stricter regulations on antibiotic use in medicine and agriculture. This includes monitoring and controlling the prescription of antibiotics to ensure they are used appropriately. Additionally, governments can support and fund research and development of new antibiotics and alternative therapies, which are essential in staying ahead of resistant bacteria. Raising public awareness about the importance of responsible antibiotic use is also vital. Public health campaigns and educational seminars can inform people about the dangers of antibiotic resistance and the steps they can take to prevent it. By working together, individuals and governments can make a significant impact in the fight against antibiotic resistance, ensuring a healthier future for all. Antibiotic resistance is a complex problem, but it's not insurmountable. Through awareness, education, and collective action, we can preserve the effectiveness of these life-saving drugs for future generations. The time to act is now before the silent killers of tomorrow become an unstoppable epidemic.